Let us all welcome our moderator for today, Dr. Annalisa Ong Lim.
We are joined by very distinguished speaker all the way from the Netherlands, Dr. Christine Boers-Doets, who will be speaking to us on this topic, which is something that is a concern for many breast cancer patients. We will be focusing on managing unwelcome side effects of cancer treatments. And our speaker is really an authority in the field, being the founder and senior side effect specialist in targeted therapy for cancer at CANSERVE Side Effects Institute in the Netherlands. Over the past 35 years, she has provided key stakeholders with valuable insights on turnaround strategies on how to turn adverse events into favorable events. Joining us in this session live is Dr. Edwin Tan from the Philippine Society of Oncologists, and online we have Dr. Christian Quaresma from the Philippine Society of Medical Oncology. Let's welcome once again Dr. Christine Boers-Doets. Dr. Christine, I don't think your audio is on.
Can I get my slides, please? No? I'm not getting my slides, so I'll start talking meanwhile, because I have only pictures. So if you think I'm going to tell you about miracles today, I'm going to disappoint you, because all the measures I'm going to tell about today are broadly researched and broadly applied in daily practice. Can I continue? Yeah, okay, sorry, I hear something in the background. I use them in a different order and a different setting, and that's different from what many people do in side effect management. The conference committee asked me to address 5 side effects today. This is lymphedema, nausea and vomiting, hair loss, skin problems, and oral complaints. And I'm going to share with you what you can do as a patient. And I know there are patient advocates. You can do the next slide, please. I know there are patient advocates here in the room, and researchers from a pharmaceutical company and healthcare professionals, but I'm focusing mainly on the core player here, and these are the patients. So if you are not addressed, but please listen, it's also for you as well. I hear something in the background. Is everybody unmuted or muted? Okay. Okay, next slide, please. Because on the next slide, you will see some French fries. Yeah. So what have French fries to do with side effect management? A lot. Because you see on it, in the title below that there are unwanted side dishes that you didn't order. And when it comes to cancer treatment, you get side dishes you didn't order and that are the side effects. So imagine you're going to a restaurant. You are well dressed. You have jewels on and you have a perfume on. And you order the main dish. And you have a great conversation at your table.
Sorry.
Can I continue?
Yes,
I think so.
Dr. Christine.
Oh, no, please go back. I will tell you when you can move forward, but I'm just asking because I hear some people in the background. Yes, this is the right slide. So when you are ordering a main dish and the waiter comes and brings you some French fries while you're in a 5-star restaurant, you will tell the waiter, why are you bringing the French fries? And they will tell you, it's just a side dish. It comes along with the main course. And then what many people do is leave the French fries on the table. Should I stop or should I continue? I hear people in the background all the time.
Dr. Christine, we're having some audio difficulties, but please proceed. Thank you very much.
I can move on. Okay. So please go back to the other slide. Sorry, I will tell you next, and then you can do next, but don't do next. So do the previous one, please. Yes, thank you. So what most patients do is leave them on the table and try to eat them. But you can also, you have the possibility to send them back. And that is what I'm trying to tell you here. You can do something about it. And I have learned, I studied it for decades, 35 years now, so I know a lot about it, this topic. You can send the side effects back, but you need to intervene early and you need to know what you can do. And that's what I'm trying to tell you during this lecture. So now you can do the next one, please. So you need to become partners in crime. And that is something what many people don't understand. And of course, when you are a patient or a support system, so a spouse or something else from a patient, I can imagine that it's difficult to become a partner in crime. But please consider the healthcare provider, so your physician or your nurse, they know everything about your cancer and your treatment, your cancer treatment. But they don't know you. They don't know what your needs are, how you respond on the treatment, and what your goals are. Do you really want to do everything to get the cancer in control, or will you see what will happen? And if you are a person who really wants to get side effects in control, you need to be partner in crime. That means you need to speak, to tell what's bothering you. And I really hope that you take the lead, because in my opinion, there's only one king on the road, and that's a patient. And we as healthcare professionals, we are the supporting system. And I really hope that you understand it. That's very important, because when you're not telling what your needs are, we don't know. We can't look into your head. Okay, next slide, please. Oh, this is my best patient, Betty de Koning. I have a lot of videos and pictures of her, and she really did have nearly all the side effects that can come along with cancer treatment. And I was allowed to share all the things with her. So 31% of patients can experience more quality of life just by reporting the side effects. That's a study that's performed by Ethan Bosch at Memorial Sloan Kettering Cancer Center, that 50% of the people registered the side effects by themselves. That's a study performed, and 50% of the people, the side effects were registered by the physician or nurse. And the people in the first group, where they registered the side effects by themselves, they experience 31% more quality of life. Just don't do anything else, only by registering the side effects. Isn't that amazing? So that's the reason why I'm telling you, you need to become partner in crime. Next slide, please. So the other outcome of the study is that people, when in a metastatic setting, they live on moderate for 5 months longer, just by registering the side effects, nothing else, just by registering the side effects. Write down what you experience, what you see, what you feel, and how much the impact is on the quality of life. That's it, just by registering. And then you haven't done anything else. And I tell you more measures that you can apply. So it's really important that you start to register the side effects by yourself, and that you're not waiting for your nurse or your physician to do that, okay? Next one, please. So this is a nice slide, and I can imagine that you don't understand what I'm trying to show you here. I'm trying to show you here the ask method. Here you see the bear is trying to talk to the little boy, but the little boy is not listening. And we have learned in cancer care that patients only remember 10% of what we are talking about. But that's not true. They can remember, or you can remember way more. But there is a problem here, and I'm trying to show you what the problem is. So I'm using a balloon. I'm stop talking. I'm showing you with my balloon. Wait, I'm not going to say it. So when you have heard that you have cancer, you get a lot of information about the cancer, your life expectation, the treatment you're going on, what it has to do with your work or with your family or your daily activities. So you have already a lot of information in your head. So I'm using the balloon to show you what's happening. When the balloon is nearly exploding, because there's already so much air in it, like there is information in your head, that is not possible to put more information in it. And we all the time say patients can't remember it, but how can you put more information in it when it's already full? That's not possible. So what you need to do is to deflate the balloon to get more information in your head. And how you do it is by asking questions. And most of the time I'm teaching physicians and nurses what they can do, but you as patient can do it by yourself as well. So when your physician or nurse is not asking you questions, you can tell them, I want to share with you my experience. What happens then is that everything what's in your head, what you want to share with your physician or nurse, it will go out of the balloon. So the balloon will start to deflate. Let's try it a little bit, not everything. Yes, so that's going well. And then the next question is that you tell them what's bothering you most. Because when you tell them what's bothering you most, you can leave it, you can let it go. So you get room in your head to listen to information that will come. And the next question, that's the third one, that's very important. You tell them what you expect from them today. And I know for many people that's very difficult to do, but you really need to do it. You need to tell your physician or your nurse what you expect from them today. More information about the treatment, more about a side effect, or how to cope with your work or with your family. You need to tell them what's going on in your head. So then you can let go and you can have more space for more information. So now you see the balloon is deflated, so the brain is empty, and now you're able to receive more information. Okay. And with this information, you can start your treatment or continue your treatment when you're on treatment. I hope I made it clear how it works with the brain of the human being. So because it's very important. So it's not you can't remember everything, it's just you have already so much information. And you need to be a key player in this field. Okay, let's continue. Next slide, please. The next slide is about lymphedema. That's one of the 5 side effects I'm going to address today. Lymphedema is a side effect that comes along with many people who experience breast cancer after surgery, mainly sometimes after radiation therapy as well, but mainly from the surgery. And you have, of course, you have the, how do you call them? It's the stockings. Sorry, I forgot the English name for it. The therapeutic elastic arm stocking. But I don't know if everybody is able to get it. So when you are not able to get it, you have bandages as well, bandages and band-aids. And physiotherapist can help you to apply them. So you can't apply them by yourself because you need to know what to do, but the physiotherapist can help you with that. And the other thing what you can do is exercises. And I know many people tell me, yeah, but I do exercises, but you need to do the small exercises. The small exercises are way more effective and way more important than the bigger exercises like in the sports school or something like that in the big gym. So what you need to do is, for instance, put your fingers together and push every time on other fingers on the thumbs. So turn it around to push it, because then you activate the lymph nodes to release the fluid that's in the arms. And what you can do also, I will have here, that's the other exercise that's very easy. So on the table, you can try to like playing piano. That's a very good exercise as well. They will help you to get the fluid out of your arms. So it's very inexpensive and very, very effective, more effective than many, many people think. So I hope you really will apply it when you experience lymphedema. And of course, there are many more measures available, but these are the ones you can do by yourself when you don't have someone else in your community that will help you get rid of them. Next slide, please. Next slide is about nausea and vomiting. That's a misunderstood side effect. When you ask me, these are totally different side effects. Nausea has nothing to do with vomiting. The one is a result from the others, sometimes maybe people say, but it doesn't have to be the case. It can be the case that you first have nausea, experience nausea, and then you have to vomit. But most people it's not the case. Most people it's the case that they have only nausea or only vomiting, because they are not related to one another. Yes, in some cases they are, but in most cases they are not related. And that is something you really need to know, because nausea is something that appears when you, for instance, think about food, you smell it or you see it, then you get nausea. But when you start eating, then you can, it's most of the time, so of course there are always people that are in between, but most people, they only start vomiting when they start eating. And it can be totally loose from each other, they have nothing to do with one another. So what you can do is when your partner is cooking, you can go outside or another room till the dinner is ready. So then you don't smell it so long, you don't see it so long. And then you can start eating. And of course you can eat cold food too, because warm food smells. And you have, of course, vegetables you can do into your salad or something else. You don't need to have hot food, so warm food, to eat healthy. Many people think it's necessary, but it isn't. So these are totally different side effects. I really hope that you understand the difference, because nausea, you most of the time don't treat with medication. Of course, I see it in the protocols, but it's not necessary. But vomiting, you need to treat with, yes, it's okay, you can go further, with medication. So these are different side effects, and you need to report it very well. So you need to report if you experience vomiting or you experience nausea. I hope it's clear, and otherwise we have the Q&A and then can go deeper into it. So the next one is hair loss. And I know many people, when starting cancer treatment, they are bothered that they will lose their hair. And I can imagine, because I have long hair myself, so medium hair, I don't want to have a bald scalp myself. But this is a side effect that will go away. And I understand you don't want to lose your hair, but it's a temporary side effect. And there are side effects that really need more attention than the hair loss, because other side effects will stay forever or for years. And those are the more severe side effects you really need to address and put your attention on, to be able to get rid of them very, very quickly, so they can't bother you the next upcoming years. And when it comes to hair loss, of course, there are a lot of options available. You have, I have to have my English slides here, chemo heads, scarves, so like this lady has on this picture. There are wigs, there are caps, there's so many things available for your head. And I want to share with you an anecdote. I had a patient advocate a couple of weeks ago, and she was going to be interviewed, and there were pictures taken, and she asked me, what should I wear on the pictures during the interview? And I told her, just take everything you have with you. And when you are in a room where you will be interviewed, you will know instantly what to wear. And she had everything with her, and she told me later on, I didn't put anything on my head because I wanted to show who I am at this moment. So I had only my bald scalp, so no hair, no scarf, nothing, no wig on it. And she said, I felt so much empowered just by showing who I am at this moment. And I think it's very important that you don't listen to others, but listen to yourself for what do I need and what's very important for me at this moment. And when you start to listen to yourself instead of listening to others, you will experience that you will have more power even when you have hair loss. And I can imagine it's difficult. I understand. I'm not telling you it's not a huge problem. It is. But it will go away. And you can be in the power to say, okay, I want to show my bald scalp, or just a scarf, or wear a wig. But these are side effects that will go away very quickly. So that's the reason why, in my opinion, it's important to just understand this is temporary, it will go away. But of course, it is not nice to have. Okay. So let's go to the next slide, please. Yes, here, this is a question was about from the conference committee to talk about radiation dermatitis. And there's a lot of misunderstanding about radiation dermatitis and blisters that can come with the radiation. I'm not showing here pictures of radiation dermatitis because I'm pretty sure you know how it looks like. But this picture is more important for you because it shows the skin and it shows the skincare products that you can use to apply on your skin. And I know there are many different guidelines, but you can use the, that's the international guideline. You can use the creams upfront, the radiation therapy, but you need to wash it off before the treatment. That's what I have learned from the mask guidelines. I worked on them myself. But more important, the question was, can I apply aloe vera gel? You know aloe vera gel? I like aloe vera, but I don't like the gel. And I'm showing it you here in this picture. You see here the orange field, you see below, you see gel. It's only water. Everything in the orange field hydrates your skin. It doesn't moisture it, but your skin needs oil and water. So oil and water. So you see here, gel is just only water. So it's not a good product to use. Everything in the red area can't moisture your skin. It can only protect your skin. Like with diapers for babies, when they protect the skin with zinc oxide cream, it protects the skin, but it can't moisture it because it's way too greasy. It's too oily. So you need to have a product in the green area. So like I'm showing it to you in the next slide, but I'm showing it to you here already too. When you have a cream in a pot and you turn it around, it needs to stay in the pot. When it stays in the pot, it's okay. When it's going out, then it means it's too watery. And of course, when you want to apply aloe vera gel, because I told you I like aloe vera myself very much, also the studies say it's not a good product to use. It's not better than any other product. I have the experience that it's very helpful, and I think something is wrong with the studies. And I can say it because I did a study with bipenten cream and seed alcohol cream myself. So I compared two creams, and I can tell you, I worked together with world leaders in this area, and even we made major flaws. That means a lot of huge mistakes in our studies. And we have learned at MASC, the Multinational Association of Supportive Care in Cancer, where I'm an active member of, that there are no studies without any major flaws. So without many mistakes in the study. So my experience is that aloe vera is a good product to use, but you need to apply a cream above it. So please, when you want to use aloe vera gel, start with the gel, but put a cream from the green area above it. I hope this is clear. And when you go outside in the rain or windy weather, then you can put a protecting cream on it. So petroleum jelly or something else. But it's not going to moisture your skin. So when your skin is dry or has blisters, it only will tell you there is a misbalance in the skin and you need to balance it back. So you can do it with products from the green area. Okay, let's go to the next slide. And I think I can skip it because I will show it already. And the next slide is about mouth rinses, so for the oral complaints. So when you have problems in your mouth, there are more than 72 side effects that we know that can come with chemotherapy. We all say it's mucositis or stomatitis, but there's so many more side effects that can come in the oral cavity. And it's very, very important that you're using mouthwashes 4 times a day for 1 minute. And what I've seen in daily practice, and that's the reason why I always, with all patients, I start trying it during the consultation. I always show them what to do, because you shouldn't gargle in your throat. You should see that you're moisturizing your mouth here, and you should see it in the cheeks. So when I'm trying it here, look at me, please. Do you see it? You need to be able to see it outside. Then you're doing it right. And the reason why you should do it is very, very simple. Everybody has bacteria in the oral cavity. That's normal. But the mucosa, the skin in your cavity in your mouth, will get thinner. So the bacteria have way more chance to hurt your mucosa. So the only thing you can do, or you can do more, but it's very simple and very easy, and everybody can do it. Just swallow, wash the bacteria load away. So 4 times a day, 1 minute, that's prophylactic when you start your treatment. During treatment, when you have experienced side effects, you have to increase the mouth rinses. And what many people do, because it hurts, they decrease the side effect, the mouth rinses. So they stop rinsing the oral cavity. And then the bacteria in your oral cavity will explode. So you need to do it more often. So when it's very severe, you need to do it every hour. And not only 1 minute, but 2 minutes. This is very, very important. All the other measures will not help when you're not doing this. You need to rinse your mouth to get away of the bacteria load. This is so, so important. All the others is additional. But when you're not doing this right, nothing else will help you. I hope this will be very clear. Okay, let's go to the next slide. We have 3 more, I think. Yeah. So the target strategy, this is where I did my PhD on. On the background, you can see my book. I published a book about it in 2014. I wasn't very effective in side effect management when I started in oncology. But then I went home to the patients and asked questions, and I received all the time the same answers. And this is why I developed a target strategy. So it's nothing new, but these are things that we do already in healthcare, but not in a consecutive order. And you need to do it in a consecutive order. And what I see is that most people, most physicians and nurses go directly from the first T to the last T. And the first T is about terminology, and the last T is about treatment. So you can, but this is not good, because you're missing 4 steps. I can do the next one, please, next slide, because then we'll see the text beneath the T. And that means no, only one, please. Terminology. So it's very important that you really know, back please, that you know which side effects you're experiencing. So diarrhea is a totally other side effect than loose stool. It's not so watery. Hand-foot skin reaction. Oh yeah, I get a message, okay. Hand-foot skin reaction is another side effect than hand-foot syndrome, and cardiac toxicity is another side effect than cardiac events. These are totally different side effects, and they need other interventions as well. So the T is very important. When you start using the wrong terminology, you have the wrong diagnosis, and then everything will go wrong. So the next one is the A, about assessment. I can't treat side effects. I only treat the symptoms and the signs of the side effects, so what you see and what you feel. So I don't treat hand-foot skin reaction, for instance, but I treat the blisters, the erythema, the thickness of the skin, and so on. That I can treat, but otherwise I don't know what to do. It's just trying. And when you're sitting in a wheelchair and you have blisters on your foot soles, I can imagine it doesn't bother you so much because you're already sitting in a wheelchair and you're not using your feet so often. But when you want to run the marathon in New York, you will do everything you can to get rid of the blisters on your foot soles. So for me, it's very important to know how much it does impact your daily activity, because that means I will adjust my treatment for you, and you can adjust your treatment yourself as well. The R is about reporting of characteristics. So what do you see? And do you have pimples in your entire face or only on the cheek? Do you see 10 or 100 or 1,000? Are they red? Are there pus in it? Did it develop very quickly or slowly? Does it get worse when it's getting warm, or does it decrease when it's getting cold, or the opposite side? This is all very, very important information to know before I can choose, or you can choose, which treatment to apply. The next one is the grading. And I know in healthcare, you maybe know it as well. We use the common terminology criteria for adverse events, so the healthcare professionals do that. But that's not important for the treatment of side effects. It's important for the studies, but it's not important for the treatment of the side effect, because it's more important to understand how severe it is for the patients. Yeah, I'm getting a message here from the organization. Okay. The next one is evaluation. So you need to evaluate what the patients have done. And I can tell you, a lot of the times, so as a patient, you have to tell what you have done, because very often you have done the wrong measures or in the wrong way because you misunderstood it. And it has nothing to do if you are intelligent or not. It has to do with if you are experienced in this field or not, if you understand what the question is, what we request you to do. So I would suggest you bring the products you use for managing side effects, and you show your physician or nurse what you did, and then we can see if you do it the right way or you can do it better. And then the last T is treatment. And what's very important here, because when you have done the 5 previous steps, the last step becomes so easy. Really, everybody can do it. You can't miss it. But what's important here as well is that you hit hard, early and short. I call it a HIT method, because when you delay treatment and when you start to mouth rinse once a day or once a week, it will not help anything. Your side effects will decrease dramatically. So you need to intervene very quickly, high dose, so do it as often as you can, then you can stop already very shortly after that. And otherwise you will need to apply the measures for months or years. And I can imagine you don't want to do that. So the next slide is the last 2 I have, yeah. This is a very interesting story I want to share with you. Do we have more time? Yeah, I can continue, can I? Yeah. This is a very interesting slide. You see here, yeah, great, I get bumped, that's great. You see here an interdisciplinary team. You see me in a purple dress. And on the left side on the picture, you see Professor Dr. Olivia Pagani. She's a breast cancer specialist in Switzerland and Italy. And she invited me to educate the interdisciplinary team. So patient advocates, nurses, physicians, pharmacists, psychologists, all together in one room for 2 days, 8 hours a day, so 16 hours, because they were preparing an outpatient setting for side effects for breast cancer patients. But the first day, the patients didn't say anything. Well, I'm very interactive, but they didn't respond. But at the end, when Olivia Pagani had to leave the room because she had to go to the clinic, the patients started to ask questions. And 8 patients had side effects. 8 of the group had side effects, and they asked me what they can do. And the next day, it was 12 hours later, I asked them before the training started if the side effects disappeared already. And they said, yes, they started disappearing because it needs to disappear already to decrease within 12 hours. When you don't see anything within 12 hours, I wait till 48 hours, but when you don't see anything after 48 hours, you have done something wrong. That means you haven't applied a side effect as prescribed, or you have the wrong intervention, or you have the wrong diagnosis. It's all the time one of those 3. So it's not magic, it's just use your brain. These are only the only 3 things possible. So they all 8 told me that the side effects started to decrease already within 12 hours. So I asked them, can I share it during the training? I said, no. Dr. Pagani doesn't need to know that I have this side effect. And I told her, yeah, but she organized it for you, so you're empowered. I said, no. She does everything for me, and I don't want her to know because she's a great woman, and I want to don't disappoint her that I have the side effects. So I told during the training that there are 8 patients. I didn't say which names. And then they told me, so I told that the 8 patients helped already within 12 hours. And Dr. Pagani said, who is here in the room? Who is it? Because I want to know, because I'm here, because we want to work together. But I told you in the beginning, partners in crime. And then the first patient started to stand up and talk about a side effect, and then the next, and the next, and the next. And we were talking 2 hours about what is wrong, why it's not happening. Yeah, so much. I'm ready. So this is, I want to share with you how it can change the entire field when you are working in a different way and when you tell your stories. So let's go to the last slide, because this is what I want to share with you when you If you don't like the fries, be courageous and send them back, because it's about your life and what your needs are. So please, please start being active. That's very important. So thank you for listening, and I hope I will get a lot of questions and comments.
So much, Dr. Christine, for this very interesting session. I was thinking back to the time when I was going through chemotherapy, and I really resonated a lot of what you shared. But let me bring into the conversation our two specialists. We have Dr. Edwin and Dr. Christian, who are both oncologists. And before we take other questions, I'd like to give them a little time to share their insights about what you shared and maybe contextualize it to the Southeast Asian region in the Philippines setting. Maybe we can hear first from Dr. Edwin.
Thank you, Dr. Christine, for that very insightful discussion. It's very relevant in our practice. For me, when I see patients, I always, especially if they're going to embark on a chemotherapy journey, I always tell them, remember the ABCs or ABC of chemotherapy preparedness. I tell them that. But it's A assessment. You get your, write a journal, write a diary, then put them the history, your physical, any medication you're taking, and all those side effects you're experiencing, and during the treatment, and put there all those questions that you want to ask your doctors, so that you can have that communication. And B is behavioral change. So you stop smoking, eat healthier, do the physical examination like those, exercise, and then C, counseling. So you have to sometimes get a professional like a psychiatrist, a psychologist, or maybe a support group. Join that ICANSERVE like support group. And D, drug modification, pharmacologic modification. Of course, it's part of all of these side effects. Sometimes it's oral drugs or prophylactic treatments or some treatments again. And then last is education. You have to, try to read more on your problem, your disease and your cancer, and the different management that you can offer. Now, I remember one patient of mine, he says that education brings understanding, and understanding brings hope. And in your talk, you brought hope and understanding, Doctor. Thank you.
I think it's a good one that you're talking about is the ABCDE, but I think I'm pretty sure that not all the physicians do that.
Yes, I really appreciate
You're a good one. You're a great one.
I really appreciate that the approach is really quite systematic. I think for many patients, one of the concerns is that you just have this pieces of information. You shared, Christine, very early in the talk that for people who get the diagnosis of cancer, it really takes a little bit of time for everything to sink in. And organizing this information can help people retain it and understand it better. Can we hear from Dr. Christian?
Hello, good afternoon, everyone. First of all, I'd like to thank Dr. Christine also for that very interesting discussion on managing unwelcome side effects of cancer treatment. I would have to agree with Dr. Edwin Tan. I get a lot of good thoughts and points from him when I was in my fellowship training. So in the Philippine setting as well, we also share the same experiences with Dr. Christine. We encounter a lot of treatment-related side effects from our traditional modalities of cancer treatment, chemotherapy, radiation, and surgery. And now that as medical oncologists, we are now in a more personalized medicine. Of course, we have a lot of other systemic treatments at hand, not only chemotherapy, but we also have your biologics and your targeted treatments, which also have their own side effects. So it is really important that we focus more, that more attention should be focused on proactively monitoring this treatment-related side effects.
I totally agree. And to help people to understand how to do it in a better way, I always tell them I turn it around. I can't do it with everybody, but most people, most patients can have it. I always ask them, do you want to complete your treatment or do you want to stop early? And they say, of course, I want to complete treatment. And I tell them, when you are not telling us the side effects that you experience, we have to take you off your treatment. So you need to be aware of it, that you tell them as quickly as possible and share with us what you try to do to get them in control, because otherwise we have to stop. Do you understand that? And they say, yes, now I understand, I have to tell it. And what I do is make the partner who's coming into the office, I make him or her responsible. I'm always saying, you are responsible, and your wife or your child or your mother or father has severe side effects, you are the one who I'm going to blame. And then I say, oh, I will take care of my mother or father or something else. And this is way it's working nearly every patient. So you can't do it with everybody, but with the most you can do that. And it works very, very fine, because they always tell me, Christine, you told me I should mention it, and I'm doing it now because you requested for it. I say, yes, great. Thank you so much. Yeah.
I just find it so interesting. I always thought it was an Asian thing about being reticent about your what you're feeling or what you're experiencing, but it seems like it's a common experience for everybody. And you have to give patients permission to complain, to share what they're feeling.
Yeah, but I think patient information is very, very difficult to write. I have written a patient information about how to take care of the skin during target therapy for cancer. And I was working more than 2 years on this brochure. And there was information in it that you shouldn't shower with hot water. And I had a woman who said, after 1.5 years, when can I start showering with cold water again? Because I did it my entire life. And I said, you could already, while starting, it's only not allowed, or it's not allowed, I'm not saying allowed, but it's not wise to shower hot. But they misunderstood it. And I worked more than 2 years on this brochure to write it as clear as possible. But even so, it's very difficult when people think another way. They misunderstand what I'm trying to say. So patient information, I have learned, I've written so much information, and I'm at a board as well, the board for the studies, I don't know the English name for it, who tell if the studies are well performed. I can't remember the name for it. But I've written so many patient information and seen it and reviewed it, but it's very difficult to be very short and very clear. And that's the reason why I have the E in it about education. So show me what you have done, because then I can see if you understood it the way I wanted you to understand it. Because maybe the way I'm talking is not working with the patient in front of me. Yeah.
So I think really coming from this last exchange, the emphasis is really to make sure that there's some kind of feedback coming from the patient to make sure that we're understanding their needs correctly, and we can respond and we can modify whatever else we can change. So unfortunately, this is all the time we have. I'm being flagged by the team, so thank you once again for joining us for this session. I'd like to thank Dr. Christine and our reactors, Dr. Edwin and Dr. Christian, and also the audience for joining us. Good afternoon.